And just put who's here and which hospital you're representative in the chat. That would be amazing. Perfect.
Terrific. Well, thanks for taking time. I hope you're attending to your needs during the lunch hour here. Please eat. We love seeing you on camera, but which I often eat on camera, but I know some people have more respect than I do for that. So if you need to be off camera, no worries. So role and hospital in the chat, please. Next slide. This is actually our last formal call. We really want this to be an interactive experience, and we would love to hear from you in the chat about anything, what you're up to, what your questions are as we roll through the short portion of this call that is on slides. And please stay at 12:59 to fill out the evaluation, because we are a quality improvement team and we have to know what's working and what's not working. Next slide. Okay, really quick agenda. Lots going on. We're glad you're here. Our health department colleagues are going to take us through the voluntary acknowledgement of parentage form and the highlights from the quarterly birth reports. Our data manager, Courtenay, is going to show some spotlight on the data that's been collected so far to keep us data driven and focused on what we know and need to still know. And then please do not leave this call when you see that we're going into breakout session. It will be painless. We're actually sending you out by hospital and with one of our team with you, because this is when we're really going to delve into what's working and what you still need from us as we plan our support of your great teams as the calendar year ends. So next slide. I'm going to turn it over to Cindy.
Hello, everybody. Looking at the attendees, I think I've spoken to a lot of you over the phone. I'm Cindy Hooley, the Vital Statistics Information Manager at the Department of Health. I'm going to give you, I understand there were a couple of hospitals who had raised some questions about the voluntary acknowledgement of parentage forms. I'll give a brief overview of the process, but because the VAPs are outside the scope of this quality improvement initiative, I will say if you have some specific questions or follow-up items to contact me directly, or you can reach out to John DeMichael, who is our state registrar. So voluntary acknowledgement of parentage form is required for a second parent to be included on a birth certificate when the parents are not married. I'm thinking that most folks on this call are aware of that, but the process currently is that either the hospital will collect the VAP from the parents and send it to the Vital Records office at the Department of Health, or give the VAP form to the parents with instructions to send it to Vital Records. Under Vermont statute, the Department of Health is responsible for filing these forms. So one of the things I wanted to mention here is that hospitals should not apply any stickers or handwritten notes. We've had VAPs come in with patient medical record numbers on them. These are legal documents. We often provide copies to parents or to Department of Children and Families staff to use in court cases. So any extra information should not be included on these forms. Then the hospital staff who are responsible for entering the information into the electronic birth registration system, or the EBRS, should only check yes for the VAP question if they know that the hospital has a completed form. We basically say, if you've got one in hand, that's the only time you should check yes. And then they do not enter the second parent's information in EBRS. The VAP will then come to the Vital Records office, and they are processed generally within 2 days of receipt. Each form that we receive has to be reviewed for completeness. If it's completed, we accept it for filing, and Vital Records staff enter the second parent information into the EBRS. If it's not accepted, a letter and the form goes back out to the parents, and this occurs within 5 business days. In addition, we conduct monthly audits to be sure that if somebody has checked VAP equals yes in the EBRS, that we actually have a VAP on file. If we don't, we follow up with the hospitals for any missing VAPs. I've heard that hospitals get contacted by parents about who want confirmation that the second parent was added to the birth certificate. The Vital Records Office also receives many calls and emails from parents who want that confirmation. And what I would like to mention here is that some things that perhaps hospitals can do to help reduce um, delays in processing the VAPs and also to reassure parents when they are at the hospital filling these out. Make sure that the staff who enter the information into the EBRS are provided with a VAP so that they know you have one. Um, Make sure that the VAPs have been signed and witnessed before sending to Vital Records. Those are, I mean, they have to be signed and witnessed for them to be accepted in the Vital Records office. Scanned or faxed VAPs are acceptable. We just ask that you follow up with mailing the hard copy to us because we are scanning these into our system, and sometimes the faxes or the emails aren't real clear. So having the original hard copy makes that all the more, makes a better scan. Also, if some hospitals, what's happening is some hospitals are holding the VAP forms and sending them to us in batches, and that creates a delay because if you're only sending them in once a week, then it's another few days for them to get to us and have us review them, process them, and also there's been lots of issues with the United States Postal Service. So, as I said before, that certainly scanning or faxing these to the Vital Records office is preferable if you can do that and then follow up with the hard copy. You can give a copy of the completed VAP to the parents just so that they have one. They know, what was filled out and so on. They also know what the form is officially called because sometimes parents sign a lot of things at the hospital and don't realize after they got home, oh, that form that we signed, so having a copy in their records, if there was any question about whether one had been signed, they could also come up with that copy. And then finally, if you could inform parents that it may take up to 3 weeks from the child's date of birth to have that second parent added to the birth certificate. We'd rather they not call the Vital Records office within that time. For one thing, we can't discuss the content of VAPs over the phone. And then, of course, having to take the time to respond to inquiries like that and looking up information does take time away from processing VAPs and other duties that the Vital Records office has. So that is just, like I said, just an overview of the process. I don't know if folks on the call here, it looks like we have some HIM folks who probably are involved with this process. But those who may not be, I think it's important that I think we've been trying to highlight this right along, that collaboration and communication between the HIM folks and then the folks on the birthing floors or women and child units, whatever they're called in your particular facility, that there is communication so that everybody is on the same page and aware. Has a VAP been filed? Where is it? So that the folks doing the entry in the electronic birth registration system have the information they need. And that's all I have to say on the VAPs.
Thanks, Cindy. How about questions for Cindy about that? How does that land? Is that what folks were needing the reminders about? Any feedback from the team here? For the team, from the team? Oh,
Looks like
Marissa has a
somebody, yeah.
question. Yeah. You're welcome to unmute and do it verbally or pop it in the chat, whatever you prefer. Marissa? Might be hard to unmute. That's my.
Sorry, I'm
There
here.
you
Can you
are.
hear me?
Yes.
All right.
Yes.
It took me a while to connect to my phone so I can talk to you guys. So Claire and Pam, who processed the birth certificates here, are just wondering about same-sex marriages. What is it?
Same-sex that aren't married.
Same-sex that are not married. And what's your question, Claire? Do they need to fill out
Can
the,
they fill out a VAP or not?
can they fill out a VAP or no?
We,
Question is.
so I'm not going to get into all the different parenting situations here because it does get very complicated. And I think what we have said before is if you have parents who insist on completing a voluntary acknowledgement of parentage form, collect the form, send it to our office, and we'll go from there.
That's what we've been doing. Cool.
Yep, that's perfect. That's exactly what we've been doing. We just wanted to check.
Awesome. You got the expert here, team. Other questions for
Yeah.
Cindy?
Not necessarily the expert.
You're my expert, Cindy. What do we say when the significant other is incarcerated?
They have, I mean, if they want to submit, a VAP can be submitted anytime after the birth occurs. So if you need to go and get a signature from the incarcerated individual and have that witnessed, that's, I mean, that's the only way it can be done. You need the signatures and a witness. So I guess the response to the parent would be, if they want to submit a VAP, they need to collect that person's signature.
I'm really glad we're talking about this. I think the system issue here is get the form done, however you can, get it up to the health department,
As soon
and then
as,
the rest happens at that level. So you as the interface with families don't need to know all the complexity. I like
that,
things like that. But
thank you.
but what I really like what Cindy said is for you all that are interfacing with families to say, okay, here's this process. It takes a bit of time, and so we're going to be patient while we wait to hear back from the health department, right?
And Brina, I would just add, which is another thing that we've tried to communicate, is that you don't want to ask a lot of questions because then you end up hearing more information than what you really need to hear and what you want to hear. If parents have questions, they should be reaching out to their own attorney or contacting the Department of Children and Families because there are very unique situations and we can't answer legal questions either. And we
Right.
certainly don't want the hospitals in the position of having to do that. So.
Great. Okay. Want to move to the next slide for Cindy also?
Okay. So this is the quarterly birth report. Hopefully most of the folks on the call here, you're somewhat familiar with this, hopefully have seen it. If not, I'll mention at the end how if you haven't seen this and would like to, how you can get on the distribution list. But we generate these quarterly reports about 6 to 8 weeks after the end of each calendar year quarter. This is one from calendar year 2024, the second quarter, just as an example. These reports are emailed from our vital statistics analyst, Matthew Mayberger at the Department of Health. So you will see an email from matthew.mayberger@vermont.gov. The report goes to several individuals at each facility, which includes nurse managers, HIM staff, and in some cases, some obstetric chiefs. Page one, there's 2 pages to the report. The first page actually highlights timeliness in birth reporting. And you'll see over on the right there, each hospital is listed so that you can compare your hospital to other facilities. But under Vermont law, birth certificates are supposed to be reported within 5 days from the date of birth. And so what we're showing here is the percent of live births at your facility that were reported within the 5 business days. This page also gives a summary for your specific facility compared to statewide totals of selected indicators of interest, things like VBACs, adequacy of prenatal care, premature births, breastfeeding, and you can see a few other items listed here as well. Next slide, please. So this is the second page, and page 2 of the report lists selected items that are often left as unknown or marked as unknown in the electronic birth registration system. As folks here know, unknown values limit the usefulness of birth data. Furthermore, the CDC's National Center for Health Statistics tracks unknown responses and sets acceptable tolerance levels across the country. Under our Vital Statistics Cooperative Program contract with the NCHS, we are required to follow up with facilities when percentages are above the set tolerance. And on the report, items above tolerance in your facility are noted in red on the report. So on this one, you can see that the percent of unknowns for somehow this doesn't look, it's not highlighted in red on the slide here, but the month of last other pregnancy outcome, and then each of the cigarette smoking, the first trimester, second trimester, third trimester, as well as pre-pregnancy are all above the tolerance levels. So what we do with this is you see this report and then a separate list of records, the individual records with these unknown values, is subsequently mailed to the hospital staff who are responsible for entering the information in the EBRS with the expectation that they follow up for the missing information or that an explanation is provided for the higher rates of unknowns. And again, I'm going to mention the importance for communication and collaboration between the clinical staff and the HIM staff or whoever is entering the information in the EBRS. I've actually had some of the folks who we talk to on a regular basis who are entering the information in the EBRS say things like, when we're following up for this missing information, well, it's not coming down, quote, from the floor, or it's not being entered into the chart or the record, or, well, we can't tell them, meaning like the people on the birthing floor or the nurse managers or the WCUs, what to do. And that's where, I mean, the whole purpose of this quality initiative is to help you folks identify some ways of improving your processes and things. And this, this is definitely, when we hear responses like that, it's like, okay, there's a lack of communication here that really needs to be addressed. So I wanted to make sure that people are aware of this quarterly report and hopefully that you find it useful. If you have any questions or comments about the content, please email me at cynthia.hooley@vermont.gov, and I can put that in the chat after. Or if you would like to be added as a recipient for the report, I would ask that you send an email to Matt Mayberger with your name, your title, and the name of your facility, and ask that you be added. And again, I'll put that information in the chat in a minute or two. Oh, thank you, Julie.
Yeah, but put Matt in too. Do folks want to, I mean, this is an interactive call, so are you aware of this report? Do you get it? Was this a surprise to you? What's your reaction? You can just pop in the chat if you're aware of it. I love reports like this, but they often go the wrong, not often, but nice. Okay, good. Terrific. All right, keep the feedback coming on that. Jenny gets a copy, Cynthia, yep, Elisa. Nice work there, Cindy. Sounds like people are well aware of this great resource.
I guess
Oh,
my question is, though, I mean, is what I said true, that, I don't know what we've got for a mix on the call here, and maybe we can get into this a little bit more in the breakout sessions, but I think, I, when we follow up for the missing information, are you able to get it? Do you find resistance in trying to get this information? Those are kind of the things that we want to help folks work through or whatever.
it would be a great tool to bring into your teams as you're building or continuing those relationships. I think this process improvement project has helped strengthen our relationship with the HIM team for sure. Monica, thank you. We're going to put that on the brochure, the quote. And Marissa's saying, once I get the information missing, I go back through the patient chart and for the most part, find it. Yay. There, quality improvement at its best. Stacy says we've checked for missing information if able to find re-education with the data team. Yeah, see, that's gold right there. And now I think you have the clinical folks, I think now you really do know this HIM job is hard. And there's a lot of responsibility to filling this out and for all the reasons stated. So any help you can do, either with the report or ahead of that, to make sure the processes are right for accurate data. Okay, off to Courtney, I think. Next slide is... Oh, I think well, this is me. We just put this in every time because it's what we do in quality improvement. We say the same thing over and over again. We just really want to remind you about the teaming. And also that we're all here for you and that we want your staff to feel they have the right training, they understand what they're doing, and that the interface between the clinical teams and the HIM teams is strong. So just a slide to remind you of that. Next slide. Okay, Courtney, take it away.
Everyone, I'm Courtney and I'm the data manager here at the PQC. I think I have been in touch with quite a few of you about this project. If not, hello.
Courtney, your
So
sound's not great. Is it great for others? I think maybe lean in. These computers have silly microphones. You might have to lean closer.
yeah, over here. What I do is I'll turn my video off and I'll bring it closer.
No, that actually made it worse. Bummer. I don't think it's internet though. I feel like it's the microphone on the computer. That's just my diagnosis.
Courtney, are you in the office?
Yes.
Now we can
Okay,
hear you.
that's better. Try, and if not, I can deliver the content.
Okay, I'm gonna shout. All right. So we have gotten a chance to look at 5 hospitals worth of data so far. And so these findings are representative of what we've seen in those 5 hospitals. We are in progress of reviewing 2 other hospitals worth of charts. And then in the other hospitals, we're still pending access to their EHR. Can you hear me? Can I get a thumbs up? Okay. So far, the variables that we have seen that have the closest match from the chart to the birth certificate are whether or not the infant is breastfed, gestational diabetes diagnosis, induction of labor, and the insured categories of Medicaid and private insurance. Next slide. Now, the variables that we've seen that have the biggest difference from the chart to the birth certificate data, or what we like to say, have the most room for improvement, because this is a quality improvement initiative, are whether or not there was premature rupture of membranes, pre-pregnancy hypertension, and pre-pregnancy diabetes, and the insurer categories of other payer and self-pay. So it's pretty interesting if you compare those two sets to each other. But I do want to clarify that this data is very hospital specific. So when we are looking at your own hospital's data, these best and most different or most room for improvement variables may be different, and you should expect that. Next slide. So that brings us to our QI office hours that we're going to be hosting on December 4th and January 8th. So what we would like to do is break out each hospital team for a 15 to 20-minute call with us to go over your own hospital's data. Because while the information in the past two slides is helpful and relevant, it won't be as relevant as seeing what's going on with your team. And we do see these differences. So we will be able to show you how well the chart data really is matching up with the birth certificates. And then we can see where are the strengths, where is your room for improvement. So we would be sending out some emails to schedule for the hospitals that have already provided access to charts within the next week or so. And those hospitals will be on December 4th. And then the hospitals that are still in progress will be on January 8th. But please block off those times if at all possible. And if not, we can work with your schedule, because this will be very valuable data for the project. Next slide. So along with this, we will be circulating our revised tip sheet. Additional details were added for clarity. We really went over this quite a few times to clarify some of the variables that are bringing up the most confusion. So we updated this and we'll be sending it out. This means that the document that was circulated prior to this should no longer be used. And the one with this highlighted, updated October 23rd is the one that your team should use. And please make use of that right-hand column where you can add in your own hospital-specific tips, because your EMRs may work a different way than another hospital. And if you have a shortcut or an additional definition that might be helpful, that's where you can go in and modify it. Next slide.
Okay, so here now is your chance to talk to each other. So we're going to do some breakout sessions here, and in your group, we're hoping you'll touch on what additional information and training you and your team need. What are strategies you're going to use as a team to continue to improve birth certificate information at your hospitals? What are your on-the-ground reactions to the list of strong accuracy variables and the variables that are more inaccurate? Does this track with your experience? And then regarding specifically the payer information section, is this information hard to find in the chart? Is it left blank? Is it left up to your interpretation? So we're going to ask also at the end, we're going to have a little moment to share back with a larger group. So if you can kind of take note of some tips or thoughts that you think that everybody would be find valuable, just kind of identify someone to speak out or take note of some things you might want to share. All right, we're ready to go into the groups.
I learned something valuable about you have to put the prompts in the chat now for people to see it when they go out in the group. So hold, please. There. So off we go now. I just wanted for folks to have those prompts with weird formatting, sorry, for discussion. And people know how to do this. You go to join breakout room and it says which hospital is yours, and off you go. Take us through the debrief, or if you want me to.
I was planning on it, but and I welcome everybody. Sorry, I didn't notice everyone coming back in. I wanted to, yeah, open it up here. Now we have a chat, and you can also unmute and offer your opinions or your thoughts on your conversations. But I just would love to hear what people have to say from each region. So we can call out regions, or you can just raise your hand or speak out or put things in the chat. It's up to you guys. Any thoughts on the questions? Okay.
I'll get us rolling because I had a great conversation with Hope and Marissa at UVMMC. And a pretty important question came up at the end that I think others will share or others have experienced. So Marissa from the health information side was wondering if nurses could be with parents when they're filling out their worksheet as a way to sort of assure accuracy and quality. And Hope was just starting to say, as we were debriefing, that's clinically not possible based on how busy the nurses are and how important the flow of the situation is. It would be not possible. So those are the kind of wonders that make total sense to me from the HIM side that then come toward the clinical teams and say, oh, I get it. That isn't going to work. And the other thing our group unroofed was well understood. Some of these indicators that are coming in inaccurate involve pre-pregnant diagnosis, which involves the access to the pre-pregnant record coming into the hospital record may be a quality improvement opportunity. If it's the same electronic health record, it's like a seamless, beautiful population. In the UVM system, of course, there are multiple OBs that see patients outpatient pre-delivery, and they have different electronic health records. So there isn't that continuity. So nice body of work there. How would we know if someone had diabetes pre-pregnancy if it's not in the record? So, and it came back down to that idea that the clinical teams can help our HIM teams very much understanding diagnoses, definitions, and that the tip sheet is of great value. That's our group.
Thanks, Serena. Yeah, so I think we have some directions for like additional information or training or possible QI kind of support, at least on one topic. Any other thoughts on any of these questions? Like additional information or training you might need, strategies you're going to use as a team to continue the improvement. We got a So Julie Parent says feedback from CVMC team on ensure the payer information is never an issue in our department, as we are familiar with the release of information piece. So we have trained in actually printing bills. So this is breezy for us. Okay, any other variation from that for anybody else? That's CVMC. The other thing too, thinking people can always email us if something comes, if they think of additional future trainings they might need.
Hey, Katie, this is Cindy. We did learn from one of the folks in our room that the parents are actually filling out that question on the facility worksheet about the insurance, and therefore, although Susie from Brattleboro was saying that they're familiar with the parents. The parents very often will check a box like private or other and then write in the insurance. And so depending upon what it is, when Susie's HIM team is entering the information, they may end up correct, putting it in a different category, or if it doesn't seem like it's in the right one. But I will say, I
Okay.
think that's Courtenay and I were commenting that seems like that would be a little confusing for parents to answer directly,
Mhm.
based on those categories.
Anybody have any other thoughts or feedback for Cindy's group on that? About having parents? So it seems like there's a little bit of variation on how that particular variable is filled out. Anybody have any other processes besides those two?
I really want to take what Julie put in about CVMC and learn more about that and amplify that for other hospitals. We're having a lot of trouble with the payer
Mhm.
inaccuracy. So if there is something easy peasy, what'd you say? Easy breezy. NVRHR providers help fill out the facility worksheet. Awesome. We do have a poll for you all on what to do next. So I want to just summarize a few things here. One, the office hours are going to be really rich, and we really look forward to seeing you there. Second, we've had such a load of information and such great relationship building. We're going to put it all up on the VCHIP website probably by December, so that you can bring new staff to the resources, look back if you might have missed a meeting, kind of stay in touch with the efforts, because we are not abandoning you. We are just sort of at the wrapping up these 4 shared webinars. So the office hours are going to be key. But what we really need to hear from you, and this poll is going to tell us, how do you want to move forward, especially starting in the new year after the office hours, to keep going on this important pursuit? You've got the health department here, you've got the VCHIP team here, and we want to know what would be most helpful to you. So Angela, I think, is going to do one of these magic Zoom polls. How can we support you? What do you need? Do you want to meet monthly, twice a year, annually? And you can check all of that you want. Do you guys see the poll? Here's hoping. Can someone confirm they're seeing? Oh, thanks, Allison. The key to Zoom, you guys, is the more ... box. That's where I find all the stuff. That's where the poll is if it's not coming up. And I'm not answering the poll because I'll be biased. Angela, can you tell if we're getting responses?
Yeah, we have about half of the people responding, which is great.
Yay.
The ... that Brina was referring to is on the top kind of right of your, well, I say
Well,
that,
it's
that's
funny.
what it
Mine's
is
on the
on my
bottom,
screen.
Cindy.
Oh, is it?
Yeah,
Sorry.
Zoom is mysterious
Oh,
because
yeah.
some people do updates and some people can't find breakout rooms. It's all just your own system tells you. Mine's at the bottom.
You're right. It does say, it says more with the ... I was looking at the wrong ... at the
Yeah.
top.
Oh, yeah, that's a different ...
Mm-hmm.
Poll quizzes. Okay, there's 26 of us here. Probably 6 didn't fill out the poll because we're the planning team. So how many you got out of 20 there, Angela?
I have 15.
That's pretty good. I think we can show the results. We're going to take this information back to the planning group and figure out how to meet your needs. And it's not a zero-sum thing. It's all especially the training, because the staff turnover and the training would be great. Oops, I just saw it and then it went away again. Oh, there we go.
Okay.
Can everybody see it? Or just me?
everyone should be able to see it?
Yeah.
We can all,
Okay,
Okay, good.
so 20% want monthly, 80% twice a year, 13 once a year, and half are saying yes, annual training. That is super helpful. And reminder too, with new staff, I mean, if it's an annual training, great. If you know it's always the same time of year, we can predict that with you. But there is national training, very well done for your new staff in the interim. Don't feel like if someone's hired on March 31st and the training was March 28th, like, oops, have to wait a year. That there are other avenues. Okay. 12:56. We're so grateful for your time, but we're mostly grateful for how hard you're working to improve this process. And we are really grateful that you're figuring out teaming and talking with each other and creating space for both big important groups of professionals. RedCap link is in the chat. I feel like if we go to the next slide, there's a magic yes, look at that QR code because it's 2024. You can either do RedCap or you can QR it. A test of technology. And we're going to leave these open and sit here quietly so you can tell us what we can do better. And if you're done with the evaluation, thank you and head on out. We're done. Last time we stayed on and everyone waited for me to say that sentence.
Thank you.
Thank you.